am Dr. Vasant Kumar, Senior Physician at Apollo Hospital, Jubilee Hills, and also at Apollo Clinic, Manikonda. Today I am going to speak to you about diabetes, about its importance of diagnosing and treating and its incidence. As many of you may be knowing that there is a rapid increase in incidence of diabetes all over the country, especially of course in the urban areas. So what is important is that we must realize that we are seeing diabetes amongst young people at the age of 30. Actually, I see many times the parents bringing their young boys or girls who are just about 30 becoming diabetics. So it's important to control and to prevent diabetes amongst the young people. The reason, as you know, it's mostly because people are not doing exercises. They have become very sedentary. Most of the jobs are also most of the jobs are involved where they are sitting across with the computer and other things. They don't do physical exercises. And another important thing is the food that our people are consuming. We should make sure that people start eating healthy food right at the childhood level itself. You also see overweight even amongst the children. And when it happens among childhood, by the time they are 30, they are overweight and they are developing diabetes. So what is important about the diet? What is most important is avoid fast foods, junk foods which has got a lot of fat, and avoid eating refined foods like white rice, avoid too much of sugary items and also other fatty foods. So many people do not know that they have diabetes. Do you know that in India, almost half of the people who have diabetes, they don't really know that they have diabetes because they have never checked the blood glucose. So what is important is people after certain age, especially if they are on the overweight side or if there is a family history of diabetes, they should definitely check their blood glucose at least once in a year so that we diagnose the problem at an early age and so that we can treat the condition and control the blood glucose and see that they don't develop any complications in the future time. And especially when it happens in the people around 30 or 40, they should be more careful because they have another 30 years of active life. So we are not just only giving higher length of life, longevity, but we also want to give them good quality of life by providing good treatment and see that they lead active life. That is one. And especially those who already have diabetes, they should be careful with their diet. Generally restrict the calories, that is carbohydrates. Take less carbohydrates, and whatever carbohydrates they are eating, it should not be refined. So nowadays millets have become popular. Millets are important because they don't raise the blood glucose just as the white sugar or white rice. So take any millet, all millets are good, and take them in proper quantities, mix it with dal or vegetables. That will be a healthy diet. And of course, other things are eating some good protein is important. Reduce your fat. Don't eat street foods. Street foods are very bad. Street food has got very bad fat in that. They keep on boiling the rice more times and they use bad items. So that is also one reason. When I am talking about street food, I am talking about samosas, dosas, especially biryani, which are eaten by most of the people. So that should be reduced to avoid diabetes in future. More important is they must do a regular physical activity. This physical activity depends on the age of the person. Suppose you are dealing with very old people, we can ask them to do something at home, simple exercises. Those who are younger, they should definitely do something in the gym or do a brisk walking exercises. And more importantly, they should follow the doctor's advice as far as diabetes is concerned. That is doing the blood glucose levels as required, maybe once in a month, maybe twice, depending on the doctor's advice, and take the medication regularly and make sure that their diabetes is under control. Also remember, it is not just controlling blood glucose. Those people who have got diabetes, they should also control their high blood pressure. They should control their cholesterol by taking all precautions and also taking required medication and taking the advice of the doctors. So here we have many centers now which provide all kinds of diagnostic facilities to diagnose and monitor diabetes and other many non-communicable diseases. Then we have specialists who can manage and give you proper guidance to manage non-communicable diseases, diabetes. So let's hope that our we can prevent diabetes and also see that our patients with diabetes are well controlled. They are maintaining their blood glucose and they are leading normal life and also having a longevity of life. Thank you.